Today we're going to talk about the medical assistant or nurse role for rooming a patient. I've already opened a note and the patient has been roomed. So now the nurse would go into the room to take care of the vital signs and any other necessary duties. The first tab of the note is here. And so it's the vitals portion. You can see that this particular clinic is configured for normal vital signs as well as some additional vital signs over here on the right. This is fully customizable. You can have additional blood pressures to do orthostatics or repeat blood pressures if the blood pressure is high. You had head circumference here for pediatric patients, SpO2s, pain measures. Some like to use it for like a Coumadin clinic or tracking system. You've also got some additional things listed here, which I know for this particular build is for a weight loss clinic. So there's many different ways that you can configure this. You also see there's a box here that shows the flow. And so this is going to show your vital signs in a left to right fashion over time. So I'm going to go ahead and document my patient's vital signs. You can tab through these options if you would like to, or you can point and click. The BMI auto calculates based on the weight and height that you put in. You can see you've got a refused button if you need to use that. You can also, under the weight section, you can, anytime you see a magnifying glass, you can select that and search, and it will tell you all of your possible options. So it would be important if it were a pediatric patient that you could do it without clothes or diaper. But it's not a mandatory field. You don't have to complete it. So I put in the temperature. I'm going to put in my respirations and the heart rate. As you can see, there's many different options for position, location, etc. Okay, so I'm done with my vital signs for all I'm going to enter. The next tab that you see here at the top is your common problem palette. I'm not going to go over that in this recording. Some clinics will have the nurse or medical assistant go ahead and start the common problem palette for whatever chief complaint there is, but that's not all clinics. I'm going to go ahead and click on the CC or chief complaint tab. You can see up here at the top, you have a free text field under the notes. We discourage you from using this on a routine basis just because this data, there's no way to extract it easily if you wanted to run a report or report quality measures or anything like that. You do have a most frequently used that will build and continue to grow as you use the system. Everything is divided by system on the left. This is also customizable. Some clinics may not want all of these systems available, and so you can customize that. For today, I'm going to use constitutional, and I'm going to say that the patient has come in with a fever. If by chance you've selected something incorrectly, all you have to do is select it again and it removes it. When you have it, it's like a dark blue color, it populates it at the top so that you can see it. You could also add additional notes. If you've done it incorrectly, you simply click it again to remove it. You can also select the delete button to delete it there. You can add as many different systems and chief complaints as you would like. I would just encourage you to be aware that whenever you choose a lot of chief complaints, that drives your HPI section. And so you could end up having a very large HPI section to complete if you had 10 chief complaints. So for now, I'm just going to use fever. I'm going to go ahead and click on my HPI tab at the top. If you don't select a chief complaint, this whole section will be blank. So you must select at least one chief complaint in order to have an HPI section. So I've selected fever. You can see on the left side, you've got all the different categories. So for quality, I'm going to say it's acute. My onset is sudden. I'm going to say it started 8 hours ago. So as soon as I selected this option, it puts my cursor at the top, and all I have to do is type in my number. You don't have to click up here. It will automatically populate that field because there's an underscore there. You can see as I work from left to right across the screen, it's going down the categories for me. So I've done 3 categories. Now I can start back over and select here for my temperature, and I can report what the temperature has been. I can fill in whatever is appropriate. You don't have to fill them all in. You can skip some. I can skip down to ill contacts if I would like to. And here might be a section that you would want to add an additional note. Say grandchild is ill. You can do triggers, alleviating factors, whatever you need to use. So I've completed as much as I wanted to of that section. I'm going to go on to the next tab, which is the history tab. So you want to keep your history tab updated each visit. This section is also customizable. Some people don't want all of these options here. Preventative care is a good thing to keep updated for that patient for colonoscopies. Maybe they're a diabetic and you want to track how many hemoglobin A1Cs they've had. So it can be used for many different reasons and it can be updated each time. Medication history. This is like your medication list. And so you would want to keep that updated, reconcile it at each visit. If they're not on any medication, you have a button at the top that states patient takes no med. Right now, this particular clinic has this set up to show inactive medicines and active. So I'm going to go ahead and add a medication that the patient is on. I'm going to say that they take losartan, and it's going to ask you if you want to specify the SIG details. I encourage you to say yes, so that if the provider wants to refill that medication, the SIG details are already there for them. And so if the patient has the information or brings the bottle, you can go ahead and simply populate this information. I'm going to take 1 tablet daily, every day, and you can select days and refill, but you can also leave that section blank and just say, okay. The way that I got there was simply by clicking in the box that said take. So I can add my start date if I know the date that they started taking that medication based on the bottle. I can also, it will auto-populate based on what you select, your end date, if you fill it out when you're completing the SIG details. So if I select 30 days here and I say, okay, you can see it auto-populated my end date and it started with today's date. Let's say that I know that the patient actually, according to their bottle, started on the 1st. That's going to automatically change your end date. You can list your prescriber, and so you can build that if you wanted to list a prescriber that's outside the organization, just so you know that you don't need to refill that because maybe the cardiologist fills it. That can also be built to do so. You have buttons for brand name is necessary, dispense is written, chronic med and high risk med. Chronic medication, we encourage you to use that. If the patient has a chronic medication like losartan, you would want to mark chronic because that allows the system to know that even if the patient comes in, let's say June 1st, that's obviously 30 days or more past the end date of this medication. And so if it isn't marked chronic, this medication will drop to your inactive medication list on the med list because it's expired. If you mark it as chronic, it will leave it in the active medication list for you. It just makes it easier to keep track of your refills if you do it that way. If you had added the number of refills, that will also automatically change the end date based on however many refills are listed. You have a pharmacy instruction section, and you also have an internal note section. I'm going to go ahead and say save. There's also options to be able to import medication histories from the pharmacies and what the insurance company has on file, but we're not going to go into that during this session. You can see now that the active medication list is losartan, and then it has an inactive that they were on amoxicillin at one point. The review of systems is next, and you can see that would be something the provider would complete, so I'm going to skip by that. Assessment tab may be something that you would complete as the person rooming the patient. If you select new and search, it's going to bring up all of the different assessment forms that are built in the system. This is also something that's customizable. So maybe for this particular patient, I want to go ahead and do a PHQ-9. So I can select that, and it's going to bring up that particular assessment form for me. All I have to do is fill in my appropriate boxes based on how the patient answers the questions or filled out the form. You can see as I check marked up here, it's auto calculating my score at the bottom for me. It's going to save this. I could add another assessment form by selecting new. PE is for the physical exam. That would be for the provider to complete. Results is where you would document your labs if you performed an in-office lab. You can also see that your PHQ-9 will show up here once your note is completed. And so it's an easy place to see the PHQ-9s or other assessment forms as long as it's built that way. Your diagnosis is also here so that you can select a diagnosis appropriate for the visit if that's something that you typically do. We have the plan, which normally would not be something that somebody rooming the patient would do. The RX is where they're going to prescribe any medications needed. You can see the losartan is already here with all of the information listed for that provider, so it's easy for them to refill. The services performed tab is like your charge sheet or your super bill. It's auto-populated that we did the PHQ-9 for us, so it's already got that listed. And then if there were injections ordered or labs ordered to be done in-house, anything to be completed and charged for out of the clinic would be on this section, and this is where you would go to find it. The SO tab is for services ordered, so that's going to be things ordered outside of the clinic. So referrals, x-rays, DME, it's fully customizable what you list here. Your visit text is simply a way to look at the note that you've compiled so far. It can take it just a bit to populate. I can scroll down, I can see here that I have my PHQ-9 is documented. I'm going to jump back real quickly to the history tab because I stopped at the medication history. However, there are numerous other fields here to be completed. You have your drug allergy section where you can select the drug and select the reaction. Food, environmental, your immunization tab is here. We'll go into that in a separate training session. Problem and diagnosis history. I wanted to specifically mention this. Every diagnosis that's put on your DX tab in a note is going to populate here, and it's going to say active and the date that it was listed. It's important to keep this updated because it can get very long and cumbersome and be very ugly on a printed note. And so, for example, diabetes is probably always going to be active, or you have the option by clicking the magnifying glass to make that a chronic condition. Encounter for screening. That is something that we would want to mark as resolved. Acute otitis media, we'd want to mark that as resolved. And then you can categorize based on filters that are customizable how you want to see this. Some people don't want to see any of the resolved problems. Some people want to have active categorized together, followed by chronic, followed by resolved. That's all fully customizable. You do see an X over here. However, if you select the X, it's not removing it from the record. It's simply drawing a line through that particular entry. It's striking it out, but it will still show up on the record. There's a surgical history tab, which we'll go into more detail later. Family history tab, social history, and then you can add additional specialty categories if you would like. That's all customizable. So once you've completed your section and you're ready for the provider to come into the room, you're simply going to say, okay, down here in the right lower corner. Once I say okay, I'm saving the note. I'm going to leave it as an incomplete note, which is auto defaulted. That way the provider can go back in and enter that note and complete their portion. And so you would simply say okay here. It is giving you an error message at the top, so that will not let you complete it because it's telling you there's no diagnosis for 96127. So if I say okay here, it did let me go ahead and complete the note, leaving it incomplete, but I completed my portion, the provider can now go in and complete their portion of the note. You would also at this time, if you have a process where you are notifying the provider electronically the patient's ready to be seen by changing their status in the appointment screen, you could do that now.